With Nitin360.com. I'm here with Dave Schmidt. He's a PT, and I consider Dave to be the pioneer in resistance band training and in fitness training. And there's a lot of stuff that we as physical therapists can learn from Dave. Dave, tell us a little bit about yourself and why you're such a big proponent of resistance band training.
Well, I have my name is Dave Schmidt, as you know, and I've been a physical therapist for about 22 years. What I've been primarily focusing on is orthopedics. I don't work a lot with neurological or stroke-related patients, even though basic band training has a great connection there as well. Why did I get interested in resistance bands for rehab? Very simple. Our body focuses on handling momentum. And if we can teach our body how to handle momentum faster, then we are going to be much more stable on our feet. Therefore, we start eliminating injuries. The second reason is that bands create force vectors in a horizontal direction. If you look at all injuries and how they happen, most of them happen with shear force, which is a horizontal vector. If we don't train with that, then what happens is we're set up for injury. So deceleration control and improving shear force control is the two number one reasons band training is unmatched when it comes to any other training tool. And then obviously just manipulating it because it's a great tool to not only resist people, but the biggest thing is when we get people that come in from injury, they need assistance. And so I can actually assist them on weight resistance. So now I can get them walking faster, I can get them moving sooner, and I can just get them back feeling like they're doing some mobility back in their life using bands. And the cool thing is they attach to your body. So again, proprioceptively, I can drive what I want. If I come up and I push you here, you're going to feel my hand here, you're going to react. Well, if I put a band here, guess what? We're going to react. And so those are huge reasons why resistance exercise sports is so great for rehab.
You bet. In fact, I attended Dave's resistance band training workshop a few minutes ago, and I have to tell you, it was absolutely brilliant. In fact, I'm going to give you guys some information on how you can get the DVD and watch Dave in action and learn more about his products and his DVD. Dave has an outstanding DVD that can teach us as physical therapists how to integrate band training with our patients. Dave, tell us a little bit more about that.
Well, what I did is obviously I've had numerous years in practice doing work with patients and how to integrate it. The thing that I've always noticed is that we have a tendency to treat our patients like they're some kind of China doll, like they're really going to break. And what I like to treat my patients is I like to treat them and get their functionality back as soon as possible. So what we did is I went ahead and I do a thing called reactive rehab. And what that allows me to do is it allows me to show therapists how to integrate bands right in the clinic and get people moving from a systems and a resistance standpoint. And it's been a very good thing because it's stuff that I know works because I use it every day in the clinic. I'm still treating patients every day or every week in the clinic. So I really get a nice contrast with my fitness people, my rehab people, my athletes, and I even work with a little female population too. So, I can see how they all blend, and it really works out well. So the reactive rehab has been a very useful product.
So you're saying any physical therapist can take bands and apply band training to any population, or is it a specific population? Really?
Yeah, any population. The neat thing about it is the senior population is not scared of them. If you put a weight in your hand, you get a little bit fearful. And the other thing is, what's the number one thing right now in the senior population that's a big problem? Falls. So if we can go ahead and help them feel stronger on their feet, they're only going to feel better about it, and they can do that for you. Females love training with bands from a fitness standpoint. They also love doing it in a rehabilitation environment. It's just feel it. The thing that I like to people in rehab to understand is that they're working out. They're just working out in a modified version, and it's focused towards getting their injuries better, their weakness better. And the interesting thing is, as they start to rehab, we start to expand their exercise, toolbox. And all of a sudden, most of my patients within about 4 weeks of rehabilitation are doing a full fitness workout, just like what you saw on the movie. It's just a modified version. So now, they don't feel like they're rehabbing, they feel like they're in shape. And that's a much different mindset than rehab. Rehab is a stigma of, well, I'm handicapped and I'm not. Oh, wait, you're limited. You're limiting me. Let's get that limitation out of there.
Optimum function.
Yeah, and get it back. And every one of my patients works towards wellness and getting out of fitness program. That's my goal. I tell them right away, I'm going to get you in shape. I'm going to get you in shape. I'm not going to rehab your injury. I'm going to get you in shape. And by the way, we're going to make sure that injury of yours is cleared up.
So for a physical therapist who wants to learn more about band training and who wants to build a full program in their clinic, who doesn't know how to use a band training program for optimal function, what would you recommend? Buy DVDs, buy what's the right kind of band to buy? Where do they begin?
Where do they begin? The reactive rehab process is like any other program out there. You got Feldenkrais, you got all these other types of training and rehabilitative programs. I think if you can go ahead with the reactive rehab component of it, the best place to start is to go ahead and we need to get some information out to them. Hopefully we can do that. But the thing is, we need to go ahead and get them video. I need to get in there and
It should be video, not just text. It should be video.
Absolutely.
It should be video.
You have to see the video. So
and you guys have to see him in action. He's unbelievable when you see him live in action. I want to make sure you guys see that.
But they have to, it's a hard thing. It's new. The best thing to do is give them video to share with some of that, and then we need to start teaching. We need to start teaching them. And the reactive rehab clinic is basically that. It's designed to help them start learning how to use it. The cool thing about, most clinics are very low profile. Not a lot of clinics. You walk into my clinic, it's a room. If they span this camera around this room, it would be my clinic. That's all I have. I just have a room. I have a couple of hooks on the wall, and that's about it. So band training can be done anywhere. So guess what? Now you can do that whole thing to their whole program. So how can they learn about it? They need to, number one, come to my site and learn about it from a fitness standpoint. And then a good therapist, a strong therapist, which a lot of people are out there, they'll start adapting it to their clientele, saying, well, my client can do that, my client can do that. But it really starts with understanding how function happens and then how bands impact that function. And that's where I think the real awesome. You still think that the body works in isolation? It doesn't work in isolation. It's a unit.
And to be honest, we need leaders like you in our field as physical therapists to show us the way. A lot of physical therapists sometimes, don't want to learn from people who are not physical therapists. You being a physical therapist and having done it. And if you want more information about Dave's programs, go to ptresistancebandtraining.com and you can email Dave directly. Ask him if he can give out his email address. He's gracious enough to say yes. So Dave, how can they contact you?
Just go to my site, resistancebandtraining.com, or just email me at dave@resistancebandtraining.com. And all that internet stuff works. Just put the name in front of it and good to go. So those are great places to go ahead and contact me. But check out my site. Go to, you can go to YouTube and pull up my last name or my full name and get some stuff there. And then just email me. If you've got questions about it, we can maybe shoot you a few things to get you interested in what's going on.
Absolutely. Sounds good, Dave. Thank you.
Thank you very much. Have a good day.